If you're having any questions about all of this, like what is my pelvic floor? I've never really connected to it. Really reach out to, PT near you or reach out to us. We can really kind of help connect with you. It's not a scary appointment. It's very mellow. It's just a really nice way to help you connect to that area and make dysfunction get better.
Today, we have the pleasure of speaking with Dr. Tanya Goodrich, and she is a specialist. She is the person that we need to go to, an expert in pelvic health, and she's been offering her work for 15 years. She owns her own practice, and I'll let Ms. Goodrich or Dr. Goodrich share a little bit about what she does and how she advocates for women.
Thank you so much for having me on today. I am seriously so excited to be here and just kind of talk about all things pelvic health and women's health and prevention. It is my passion. And I'll just start right off the bat so I'm a pelvic physical therapist and I have been one for 15 years. It's basically a subspecialty of physical therapy that allows me to work in the pelvis with anything, as we like to say, TMI. So TMI, that means all things that you would never really want to talk about, and I get to treat it. It's the best of the world. And I'm talking bladder, bowel, sexual dysfunction, all the sexy things. I'm talking hemorrhoids and constipation and leaking, really, really important things that kind of get brushed to the side sometimes or a little bit taboo topic that no one really wants to talk about. But prevention is key. And I have had Healthy Pelvis Physical Therapy now. We're in the Bay Area for 10 years and I've grown the practice and we have 2 locations. We also do telehealth, and we now have 4 pelvic physical therapists that work at the practice who are all doing the same things. And yeah, I'm just excited to kind of get into the weeds with this and answer any questions that you have.
So Dr. Goodrich, tell me a bit about the advocacy work. And I know that you're in the United States and the Bay Area is in the state of California and the telehealth portion as well.
Yeah, so advocacy. So really, pelvic health is everyone has a pelvis, right? Everyone deserves like adequate pelvic health service, and not enough people know about it. I would actually say in a positive area, I do think that pelvic physical therapy used to be just a niche practice. And now I would say it's becoming a little more of a household name, which is super exciting. And essentially, pelvic PT is not sort of left out in the dark anymore. And personally, my mission is to eradicate shame and stigma surrounding pelvic floor conditions and treat it like you would any other part of the body. If you have a shoulder injury or a knee injury or a back injury, of course you get it treated. The same thing should apply to any sort of pelvic issue. And so in my personal advocacy, I have really become a pelvic floor speaker. And I also, part of my mission is to make it fun and funny and not dour and, oh, we can't talk about it, it's so serious. Because we just need to bring light to it and be able to laugh about it so that we don't end up in adult diapers. I mean, that is the really, if I could scream it from the rooftop, I want everyone to live long, healthy, beautiful lives, and nobody should be suffering.
Important topic today. We're talking about women's health without shame, anything and everything that women feel that we often don't want to talk about. We're going to talk about it today. You're listening to NowWhatPodcast, and my guest today is Dr. Goodrich. If you like the content of this podcast, please don't forget to follow. I am Yogi Patel, your host. And one of the things, how many women often feel embarrassed about things that happen, and we can't share this with anyone because we have shame attached to it. Well, today we're going to talk about a lot of topics that are really going to shed some insight. And I know that at my workout, where I work out, this topic came up. It really brought some insight, and that's how I met Dr. Goodrich, through a friend. Because when we're exercising and working out, I've noticed some women having to quickly make their way to the restroom. Are you one of those people who really have to run home from the grocery store, or you are just barely making it to the toilet? I think this is not something that just happens to you. I believe this is something that we all experience. However, we can't talk about it sometimes. So let's learn a little bit with Dr. Goodrich about what all of this is about and how we can sort of work on it together to have an improved quality of life without shame, without doubt, and not feeling isolated and alone. One of the things that I want to ask you, Dr. Goodrich, is leakage. Is this something that only happens to women who've had babies, or does this happen to any human being at any age?
I would say typically, right, there's two types of leaking that we need to break down. So there's the leaking that's called stress incontinence, and that's with like coughing, laughing, sneezing, running, jumping. And then there's a whole other type of leaking called urge incontinence. And that's the type where, oh my God, I got to get to the bathroom quick or I'm going to leak on the way. That's a different type. You can have one, you can have both, and that's called mixed incontinence. Now, the majority of women that have, let's say, even vaginal deliveries, stress incontinence can be quite common, right? And I use the words common and not normal because they've sort of just been normalized in our culture, right? Of course I leak. I've had 3 kids. This is exactly the type of conversation and changing the norms that I want to bring. That is not okay, right? I kind of like to make it funny, right? You'll see as we talk about this, if you can imagine a man, right, that had a tear in his penis and was just sent home, I don't believe they would just be like, okay, bye-bye, good luck. Like this is just what's happened to you, right? And it is just normalized into the conversation. So yes, that type of leaking, I would say, is more common, let's say in women that have had babies. Now, that other type of leaking that I mentioned, the urge incontinence, that can happen to anyone because that's a bladder system that has kind of gone haywire and it needs to be retrained. So the answer is sort of mixed.
Pelvic floor, right? That we hear about that word quite often. And why is it so crucial, especially in women's health?
Pelvic floor, I would say, is a little bit of an enigma. Like, what exactly is it? Where is it? And what's going on with it? So the pelvic floor is the set of, it's like a hammock set of muscles that attach from your pubic bone to your tailbone. You can imagine it's kind of the undercarriage of us. I like to refer to it as like our basement. And a fun fact is, why is it called the pelvic floor? And that's because it's the floor of your torso or of the core. So it's really just the bottom, right? And I like to say nobody likes a leaky basement. So that's the whole idea, is it's really the basement of the pelvis, and it's comprised of 3 set of muscles. And, if I had a pelvis right here to show you, the vagina and rectum are really close together. So it's a small real estate, which is why so many of bladder, bowel things can kind of get interwoven because the real estate down there is just so small. So that's kind of the pelvic floor. It's that group of muscles that surround all of the viscera, the organs down below, and also attached to the spine and the pubis.
And what are some of the misconceptions about the pelvic floor?
Oh, again, one of my favorite questions ever. Because again, I feel like a lot of times in, like, let's say biology class or human development, we don't really learn a lot about this topic. We don't learn about how often you should be peeing, bladder habits, bowel habits, how often you should be pooping, how to poop, right? So this is kind of the, like, again, it's kind of embarrassing to talk about, but we're going to talk about it right here because we all have to do it.
When do you have to poop? When do you have to pee? That's fascinating to me.
Yes. So this is, again, if I could tell one thing to every woman, I always joke that every group, every mom friend group, or any women's friend group, really, there's always one person that has to know where all the bathrooms are, right? They have to go all the time. I have a small bladder is what I hear a lot. And guess what? It's actually not small. It was just trained to be small. And we like to call that jicking or just in case peeing, which is all out of whack. So now let's go back to the basics of what normal peeing is. So normal peeing is every 2 to 4 hours. Now that might scare some people out there when they hear that. They're like, oh, no way. I can't make it more than 45 minutes to an hour. And I drink lots of water, right? Now, the key to know is that when you pee, the pee length should be at least 12 seconds long. And I'm talking 1 Mississippi, 2 Mississippi. Okay. Then if it's like a 6-second pee, that's a false alarm. So what happens is when the bladder starts to fill up, it'll give you that first signal of I'm starting to go. And then a lot of people go then. And then it becomes a vicious cycle where it's like, oh, she loves to pee. When it's 30% full, we're going to let her know. And then here we go into this vicious cycle of just repeating the pattern. So the key is to kind of do 2 things. 1, count the length of your pee. And 2, jot down the time roughly that you peed. So for example, if you pee at 7 in the morning, just go, okay, keep it cool. I might get notified in 45 minutes that it's time to go. When you get that notification, just go, hey, you think you have to go because I trained you to go, but we're just going to ignore it, give it some time. And I promise you in about 10 minutes, it'll go away. Then you're going to very calmly and coolly walk to the bathroom. You don't want to panic bladder it, right? Because we don't want to get into that habit of that bladder just kind of freaking out. We want to keep it nice and cool. You walk calmly to the bathroom and then you relax and go. So I would say that's the first sort of misunderstanding of how often we should be peeing. I feel like sometimes in our culture, we hear, oh, you better go right away or you're going to get a urinary tract infection. You're going to get a UTI, which is not the case. We want a nice, healthy, normal bladder. So that's the first one, which is kind of exciting. And then just not to brag, but I can pee for like 29 seconds. So I'm just trying to let people know out there what you can sort of get to, because that really kind of blows people's minds sometimes that it can really go, you can pee for that long. So that's my encouraging words out there, is that really it can be retrained. And then the next piece is also what I call power pushing. And that is, I go to the bathroom and I sort of strain and quickly get it out. That will resonate with a lot of people because we don't want to power push. It bears down. It puts a lot of pressure on our urethra and those beautiful pelvic muscles that I just talked about. So when you go to the bathroom, you want to relax and go. Take that moment of time and just really allow yourself to pee calmly. So that's another really important piece of information that I like to let people know. And then the other piece is really, if you're having any questions about all of this, like what is my pelvic floor? I've never really connected to it. Really reach out to, PT near you or reach out to us and we can really kind of help connect with you. It's not a scary appointment. It's very mellow. It's just a really nice way to help you connect to that area and make dysfunction get better.
If you like the content of this video, please don't forget to follow. And also, if you want more information, visit the website yogipateltte.com.